Okay, so it's good to have you people back after 2 days of leave. Uh, so before we begin with this session, I will just try to recapitulate what we have done in the previous session. That is just revise what all we have done. I hope I'm audible enough. Just tell me if I'm audible, Anas.
Yes, ma'am. Yeah.
Okay, good. Thank you so much, Anas. So we will just recapitulate on what we did last session. So in the last session, we have discussed the concept of HIV/AIDS. We discussed what is meant by HIV, that's human immunodeficiency virus. And we also discussed what exactly is AIDS, that is acquired immune deficiency syndrome. We uh, we have learned how this uh, not exactly a disease, but actually it's a complex of syndrome. How this was first uh, discovered in US in the year 1981 among the population, and we have also discussed how it affects the human body, how it subsequently lowers the immunity of the body to fight diseases, and the people suffering from HIV/AIDS, they succumb to these secondary infections, also known as opportunistic infections, right? In the previous session, we also read about the history of HIV, how it was discovered, and subsequently how it was named. What are the various theories related to the origin of HIV virus? Now there is some people, they say that it basically belonged to animals, and then it was initially contracted through animals, and it kind of mutated into the human population. Some say that it's a man-made virus. Others say that it was caused by some other factors. So there are various theories related to HIV, but till now, nobody has been able to say for sure the origin of HIV in the human population. After that, we've discussed about the various population which are susceptible to this disease. We especially talked about the professional sex workers, including call girls, including prostitutes. We also discussed about other forms like even some religious traditions they have, like in India, we have the Devdasi system, you know. So all these are the various population which are highly susceptible, especially the homosexuals and those population who are into multiple partner physical relationship with multiple partners. So these are the population which are most susceptible to HIV infection. Then in the last class, we also discussed about how the governments worldwide, especially under the leadership of United Nations, they have taken over the responsibility of checking up HIV, spread of HIV/AIDS in various countries. And I remember that um, I gave you a project or can say assignment last time where I have asked you that you have to find out what steps have been taken up by the national government in your particular country to fight this menace. So Anas, Chipiliro, Sani, all of you, I would really want that at least you give me 2 minutes of your time and just let me know what exactly the government in your country is doing to combat HIV spread. Anas, we'll start with you.
Okay, thank you, ma'am.
Yeah.
According to my research, ma'am, the
Mm-hmm.
government of the Federal Republic of Nigeria has implemented several actions to combat HIV and AIDS, which
Okay.
include stages that the government take, which include number one, national strategic plan.
Mm-hmm.
The Nigerian government has developed a national strategic plan for provide a roadmap for prevention, treatment and care.
Mm-hmm.
It aims to reduce new infections, increase access to treatment, and improve the quality of life for people living with HIV. Number two, prevention programs. The government has increased effort to prevent new HIV infections by promoting awareness, education. It also it
Mm-hmm.
also affects it. It has also implemented programs targeting key affected as sex workers, men who have sex with men, and injecting drugs users. Number three,
Okay.
testing and counseling. Access to HIV testing and counseling services.
Mm-hmm.
This includes the introduction of provider-initiated testing and
Mm-hmm.
counseling and community-based testing services. I think I'm
Okay.
going to stop here so that I will not do everything someone can get. At last,
Okay. Oh,
at last, the important it is important to note that it still faces, Nigeria still faces challenges in its fight against HIV and AIDS, including limited healthcare infrastructure, cultural
uh-huh.
barriers, and stigma. Continuous commitment, investment, and
Mm-hmm.
multisectoral collaboration are crucial to achieving better outcomes in Nigerians' HIV response. Thank you, Ma.
Okay, Nas, thank you so much for your presentation. So now I would like to invite Chipiliro. So Chipiliro, just tell me a little bit about initiatives in your country.
Hi.
Yes,
Hi.
Chipiliro.
I hope I'm audible enough. Hello.
Yes, Chipiliro, we can hear
All
you.
right. Okay, fine. I'm from Malawi. As the government of Malawi has been taking various steps to combat HIV and AIDS. Here are some of efforts that the Malawi government is doing to combat HIV and AIDS. First, on prevention. Malawi promotes safe sex through educational campaigns. They distribute free condoms to encourage protected sex. People are educated about how HIV is transmitted and how to avoid it. Uh,
Okay.
the, the second one is on test. On testing, the country has made HIV testing widely available. People are encouraged to get tested to know their HIV status.
Mm-hmm.
Testing is often free or affordable. For example, here in Malawi, when you go to public health services, you can go and test HIV free of charge. When you go to a private, you have to pay a fee. Uh, on
Okay.
treat, on treatment, those who tested HIV positive can
Mm-hmm.
access the ART, which is the medication to manage the virus, I mean.
Okay.
The government promote this medication to those in need.
Okay.
On pregnancy care, Malawi provide special care for pregnant women with HIV to reduce the risk of transmitting the virus to their babies. This is
Okay.
done through program like prevention of mother to child transmission
Mm-hmm.
(PMTCP). On community involvement, communities play a role in educating and supporting those affected by HIV. Local
Mm-hmm.
leaders and organization work to reduce stigma and discrimination.
Okay.
Lastly, in my conclusion, The aim is to reduce the new HIV infection, improve the quality of life for people living with HIV, and ultimately work towards ending the epidemic in Malawi. These efforts
Okay.
involve both government and non-governmental organizations working together to combat HIV and AIDS in the country. Thank you, madam.
Okay, Chipilero, thank you so much for this detailed presentation. It was really very informative and you presented it very well. Okay, then we come to Sani. Are you there with us, Sani? Are you there? Sani, are you there with us? Yes. Hi, Sani. Would it be possible for you to give your presentation or are you driving? No, it's okay. Let it be. It's okay. It's okay. Just continue with whatever you're doing. No problem. Maybe sometime later, whenever you can. So we will start with today's session. And so in the last class, we have started with the modes of transmission. And the first mode was transmission through sexual activities, which we have seen in detail how it is one of the largest causes of AIDS transmission across the HIV transmission across the world. Okay. Now the second, another important mode of transmission of blood through of HIV is transmission through blood. Now, around 5% of the cases worldwide, they have found to transmit through blood transfusion mostly. And we know that we have seen earlier that the HIV, it reproduces itself in the T lymphocytes, okay, which circulate in the blood and other body fluids. And the blood which is collected for transfusion generally contain these lymphocytes. Okay, we know that basically the blood consists of several other components, like you have the blood, you have the blood cells, you have the red and the white blood cells, you have the plasma and serum and all these things. Okay, so blood consists of several components, and all these components, either the whole blood or sometimes even a part of it, like sometime a person may require transfusion of plasma, sometime a person may require transfusion of some other particular aspect of component of blood. So what happens that these lymphocytes, they are present in the blood which is collected for transfusion purpose. Okay. Now, a person who is infected with HIV will definitely contain HIV in the blood. So whenever this infected blood is introduced from that person to another person which is healthy, then this directly leads to HIV infection in the person who is receiving the blood. Okay. And of all the forms of exposure to HIV, blood transfusion is the most effective means of transmitting the virus from one person to another. Okay, because there is absolutely no barrier in this kind of transmission. Okay, so the infected person and the individual who is receiving the blood, there does not does not exist any kind of a barrier. Okay, so the blood which is transmitted, that goes directly to the bloodstream of the individual. Apart from this, there are several instruments, like needles or scalpels or any other such instruments which are used for any kind of um, invasive therapies. Okay, in case if they have the blood stains of an infected person, then that blood can again go right inside the bloodstream of a healthy person. Sometimes also happen that injuries that occur with broken glasses or vials containing infected blood or serums that can directly infect it to another healthy person. So this is generally how HIV gets introduced to a healthy person through blood transmission. Now, generally, what happens? Blood that is collected from a donor, it is separated into different components. We generally use a cell separator, So it can either be separated into the red blood cells or the RBCs. We can get into platelet concentrates or even the plasma. Now, these components, they can be used separately as and when required by a patient. For example, there are a couple of persons who require only the red blood cells. There are other persons who might require only the platelet. So, depending upon the need of the person, these components of the blood are separated. Apart from these conventional uses, substances generally present in the blood, okay, like you have the antibodies. Now they are removed to produce immunoglobulin, okay. Now immunoglobulins, they are used in several medical conditions. So HIV can be transmitted through these products also, okay. And once we treat these products, in that case, the transmission can be definitely prevented. Now, what are the various means of transmission? First of all is transmission through intravenous drug use. Now, what are intravenous drug use? Can anybody tell me what do you understand by intravenous drug use? Anybody? Okay. Intravenous drug use, or we call it IVDU in short, it acts as a source of transmission of HIV because because in this case, the drugs, the drug users, okay, this is basically what happened, the syringe, it is injected inside the body and it is very frequently used by the drug users at times to inject drugs. You must have seen so many people who are using drugs or who are suffering from drug abuse. They use these needles in order to inject drugs into the body. Okay. Now, the needles may also be used by the doctors in the hospitals or in the clinics to inject certain medicine or other drugs into the body. But usually what happens that the doctors and other medical and paramedical staff, they are quite aware of the protocols or the procedures that we have to follow before we use these intravenous needles. But what happened in case of drug users, generally they do not have this knowledge. They do not have the knowledge that if you use the infected needle of a person who is already suffering from HIV infection, then there are high chances that that person may be infected. So what happens many a times, the drug users, they share these needles and they use the needles when one person has already used it, and even before sterilizing it, they are used by the other person. Okay. Now, small volumes of contaminated blood, usually it remains inside previously used needles and syringes, and these provide ample opportunities to transmit the virus through the blood contents. Okay, now in the early years of epidemic, when it all just started, studies were found linkages between the HIV drug users and the male homosexuals who were already infected with HIV. Okay, so the overlap of all these two groups, it facilitated the introduction of HIV into drug using population and then to the sex partners of the drug users. So this is how this, HIV is rapidly prevalent. So if a person, if he or she is suffering from a drug abuse and he or she uses the needles which are already infected, then that person who is likely to develop that infection, and when they are having a physical relationship with their partners, then they are likely to again transmit the same virus to their partners. So this is how infection multiplies tremendously fast. Okay. Now another manner of transmission is transmission through organ transplantation. Now you must be knowing that there are several organs now which can be easily transplanted from one person to another. Okay. Like liver is one such organ, kidney is one such organ, heart is one such organ, so on and so forth. Now, what happened? HIV is found in the blood as well as the tissue of an infected organ. So, if a person is suffering from HIV, then he or she is also likely to have these viruses in the organs. When the organ is removed from the patient, okay, like generally what happens in cases where the patients are dead, you must have come across so many cases where usually when a person is declared brain dead, then they are generally told, generally the relatives of those patients are generally asked to donate their organs, right? So in these cases also what happened, the donor has to be checked for AIDS. Although this route of transmission is very rare in practice, because generally an infected person's body fluids contain HIV, it is essential that screening for HIV is carried out before any case of organ transplantation, like kidney or bone marrow or eyes or skin, etc. Whatever organs are transplanted, they have to be thoroughly checked for HIV infection. But that is one potent mode of transmission. Okay. Now, who are the vulnerable population in this particular case? First of all, patients who are suffering from blood disorders. Now, any kind of blood disorders, be it, anemia or thalassemia or leukemia. Now, leukemia is blood cancer. Now, these patients, they require multiple transfusions, okay? You have to take them, they need frequent transfusion of blood in this scenario, okay? And there is also this particular disease called hemophilia. Now, hemophilia is basically a bleeding disorder where if a person suffers from cut or a bruise, then it is very difficult to stop the bleeding. Okay, it's generally a genetic disorder which is found in several patients. Now, in this case also, they may require multiple transfusions of blood. So all these patients, they are at a very high risk to contract the infection if the blood that is transfused into them, that is untested. Okay. Now measures have to be taken to prevent such things from happening. Okay. Now, hemophilia, we have seen that the person suffering from hemophilia, it is basically a genetic bleeding disorder, which is generally found usually in males. Okay. Now, this order is determined genetically and it results in poor clotting of blood. So, usually, what happens whenever we have a cut or a bruise, the blood clot happens and the blood stops oozing out of the body after some time. But in case of patients who are suffering from hemophilia, the clotting of blood takes a very long time. Okay, because there is an absence of a single protein which is involved in coagulation. So generally the blood is coagulated and that forms a clot inside the under the skin, and this helps to stop the blood from oozing out after some time. Now this deficiency is also known as factor 8 deficiency. Okay, and this is generally found more in male patients. Okay, generally you will find mostly in males because of the peculiar genetic hereditary that they have. Now, this is again one very this is one group of persons who are very much prone to infection of HIV. Another is we have already seen intravenous drug users, that people who inject drugs, okay, who are suffering from drug abuse, and these persons, they inject drugs through the use of needles, using intravenous needles. So we have seen that this makes them very, very, prone to HIV/AIDS. In fact, in India, in the northeastern part of India specifically, there is one state which is called Manipur. In Manipur, it is the state which has the highest number of HIV patients which were infected because of use of intravenous drugs. Okay, so most of the patients who were found infected became infected because of use of these needles, unsterilized needles. Okay, so they were basically drug abusers and they suffered from this infection because of using these infected needles for injecting drugs. Okay, now many of them, okay, another prone population is the professional blood donors. Now, these are actually people who are repeatedly, they donate their blood to the blood banks, mostly for monetary purposes. Okay. They are generally who are living below the poverty line or deprived of resources, and they become professional blood donors in order to earn money. And usually you will find that most of them are very unhealthy. Okay. Many of them are even found to be HIV carriers. So, professional blood donors should always be avoided at all costs. Okay. In fact, in India, the highest court of the body, which is known as the Supreme Court, they have banned all these professional blood donation. So nowadays we have the blood donation drives where generally we have the volunteers who want to donate blood, okay, as part of their mission to help the humanity. But otherwise, professional donors, generally their services are not very much used by the hospitals, but many a times their services may continue because usually there's a dearth of blood donation. There is the demand is more as compared to the supply. So many a times people they have to take these the help of these professional blood donors. But so nowadays, what the government has started is whenever they have a patient who require blood, or maybe a relative of the patient, uh, uh, they can always give blood in exchange of blood. Okay, so this is how they try to maintain the uh, supply of blood. Otherwise, what will happen? People, they generally don't want to give blood. So the government in many parts of the country, they have made it mandatory that whenever somebody needs blood for their relative of some of their family person, then they need to give blood in exchange of blood. Okay, so it's just not that you can pay for the blood, but you also need to donate some blood in lieu of the blood that you're taking. So this ensures that there is a constant supply of blood and the other patients also can benefit from this. Okay. Now, another very prone population is the healthcare workers. Because we have already discussed that usually what happens many a times they often get injuries due to the, maybe sometimes needle prick or, cuts from other such equipment. So they are also one population who are very much prone to HIV transmission because through blood. And in fact, in India itself, there have been several such documented cases where the healthcare workers they were infected through this route, through the blood route. And for that, I think the most important thing is the healthcare providers that they must be aware of the universal precautions and put them into practice. So the protocols should be strictly practiced in case of healthcare workers and use of gloves, use of coats and some other things that has been made mandatory by the government that should be done. Okay. Now, apart from this, there are quite many other practices that may be related to the transmission of blood infection through blood. For example, tattooing, getting the tattoos, ear or nose piercing. Now we know that this is often very much practiced by several communities across the world. In India also, as I said, the tattooing and nose or ear piercing is very common. In fact, it's a part of tradition, in our country, in our part of the country. And specifically, both the girls and the boys, they go for ear piercing. And the girls, they have to go for nose piercing also. And tattoos is also something which is commonly practiced in many communities. So they also use needles for this. Okay, so these needles again, they can act as a very important cause for transmission of HIV. And so it is important that whenever we are using these instruments or whenever we are getting these things done, we have to ensure that it is done with clean instruments. Okay, and we need to also educate the community, especially those living in the rural areas, of the risks that are involved in such practices and how you can work towards reducing the risk. Now, there are certain issues which are related to transmission of HIV through blood. And the first such issue is the blood donations and the blood banks. Uh, Now, generally, we all know that in all the countries there are blood banks where the blood and blood products they are stored, and then these are given to the hospitals or to the patients who require blood transfusions, okay, for various from time to time. Now, what happened in India, for example, this concept of blood banks, it started since 1941 and this became very common since the Second World War. And because it was very much necessary to supply blood to the wounded soldiers and the civilians during the wartime. And there are now thousands of registered blood banks, that you find throughout the country. And usually what happened, uh, earlier we had these professional blood donors who used to donate their blood after every 3 or 4 months in order to earn some money out of it. But the highest court, the Supreme Court in India, they have banned the use of blood from professional donors ever since the problem or the menace of AIDS, HIV/AIDS that started in India. Now, the second issue that is related to HIV transmission is the blood testing. So, as far as the testing of blood is concerned, in India, for example, they have made it mandatory, like in most of the countries, that there is a law that makes it mandatory to test all the blood that is used in transfusion. So, before a person is donating a blood, it is mandatory to test the blood or test that person for any kind of HIV infection. So whatever blood that is stored in these blood banks, it is usually tested well. And this is again, this has been made mandatory, and this is done in order to decrease the number of cases through the blood transfusion. Now, in several countries, voluntary blood donations they have started now encouraging these donors. So, from time to time, there are a number of non-governmental organizations or even government agencies like civil dispensaries or hospitals, public hospitals that uh, organize blood donation camps. Okay, and they generally encourage the young people, especially the younger generation, to donate blood, you know. And normally, a person, an average or healthy person, can donate blood every 3 to 4 months. And so they encourage the young population who are healthy without any kind of a disorder to donate blood from time to time so that the so that the supply of blood can be maintained for such population who require frequent transfusion. Okay. Another practice that is very much, um, you can say, uh, made mandatory is the sterilization of instruments. So whenever we visit hospitals or maybe even a dentist, it is mandatory for all these medical practitioners to use sterilized instruments, needles, in case if they are going for some kind of an invasive procedure. Especially in the needles now, they have started using the needles that can be discarded after single use. So in most of the hospitals nowadays, when you visit, you will find that the doctors they will use the needles that can be discarded. So earlier they used to be, reusable needles that were made out of glass. And many a times, apart from HIV/AIDS, these needles were also the cause of spreading a lot of other diseases like even septicemia. Okay, that's kind of a blood poisoning. So if they are not properly sterilized, and they can cause a lot of problems and infections in the blood. So nowadays, what the government has made mandatory is that they have started the use of these instruments, the needles that can be discarded after single use. So you don't have to go for sterilizing them every now and then from every use. Yes, of course, but then there are certain instruments that have to be sterilized. So the government has issued directives to the hospitals and to the civil dispensaries and to all the medical and paramedical practitioners of the protocols that they are supposed to follow while using these instruments. Okay? So any question now? Any question related to this?
No question.
Done? Okay, we are good.
Yeah.
Okay. Okay. Now, despite all the steps that have been taken by the government, we will find that there are still a lot of deficiencies that remain. And this is not true only in India, but in several countries across the world where the transmission through blood is still happening. First of all, we find that many of the blood banks that are there are unlicensed. In several countries, you will find that people are selling blood through blood banks which are not licensed by the government. Okay. And for example, in India itself, there was a study which was conducted out of which out of the 1018 blood banks that were studied, only 616 were supposed to be only 201 were licensed and the other 616 were unlicensed. Okay, now this is may create a lot of health hazards for the people, because whether these blood banks are following that protocol that has been given by the government, that is a big question altogether. Okay, most of the times what happens generally, a medical checkup is not done on the blood donors and their health status is not examined. Okay, many of the times such things happen that they are also relying on the professional blood donors because they are not having the blood supply sufficiently, especially for those persons who have to undergo very frequent blood transfusion because of their ailment. Okay, so for such patients, it becomes really difficult to get a person to donate their blood on a regular basis. So they have to seek the help of these professional blood donors. Okay. At times also what happens that although it's mandatory requirement to conduct tests on blood which is to be administered to a patient in hospitals for transfusion, sometimes what happens also there's another thing that this blood which is issued that has to be free from apart from HIV/AIDS, it has to be also tested for other things like viral hepatitis, malaria, any kind of a venereal diseases. Okay. Now, it has been reported that the mandatory tests are rarely conducted on the, before administering this blood. And most of the times, these AIDS surveillance centers are not even functioning efficiently. And most of the blood collected, almost 85% of the blood, is not screened for HIV/AIDS. So these are some of the problems which are faced still by several countries with regard to the um, following of instructions or the issues following of instructions or some other protocols by the government. Also, sometimes what happens, the storage facilities in the blood banks are also not good. They have to be, they need to possess facilities like refrigerators, which would be used exclusively for storage of blood, and that too under a specified range of temperature for ensuring the safety of the blood, to ensure that the blood does not go bad. Okay. But the existing blood banks, many times we find that the equipments, they remain unattended for years. Electricity failures are very frequent, and the use of generators are very rare. Okay, so thus what happens most of the times, these blood banks, they are generally not equipped to store these the blood properly. And many of times it does happen that many of these items, they just they are not fit to be used for patients. And most of these banks, they are located in quite unhygienic environment. Okay. And even the collection of and storage of blood is also in very unhygienic conditions. And in some places, there are reports of middlemen, okay, which operate for the blood banks by arranging donors for the persons who require blood transfusion. Now, what happened? These middlemen, they dictate the charges to be paid, and they take heavy commission. And the selection of donors by these middlemen, it disregards the level of health that has to be followed. So we find that most of the times, uh, the generally the directions given by the government are either not followed, or you can say there is a total disregard of these uh, directions. Okay. Now, apart from this, there have been certain direction which has been given by the judiciary, like in case of India, for example, the government has been issued certain orders. Now, generally, I will just give this some of the pointers to you, just for you to get an example as to what are the steps that have been taken in order to avoid the situation. So first, for example, the government has to establish a National Council of Blood Transfusion in India. That would be a registered society. Okay. And that would be directly under the Directorate General of Health Services, Drug Controller of India, or the other ministries. Okay. And so this is to ensure that the blood banks that are storing the blood, they use the directions that are issued by the government. So as part of it, most of the state governments and the union territories in India, like most of the state governments, that is the provinces, okay, they have registered societies where uh, they are responsible for maintaining uh, the blood banks in their respective territories. Then they have also been directed, the government has also been directed to launch effective motivation campaigns, for voluntary blood donations. Then they also have to launch such programs in educational institutions, in the industry and trades and other parts where you will find a large number of a young and working population. Okay. Then they also said that you need to organize various services, including the establishments and organizations of various services, including the civic bodies. Also, training of personnels who are operating such blood collection, storage of blood, and utilizing and separation of the blood groups and all that. That has to be carried out so that these persons they are able to follow the directions efficiently. Then these blood banks, they are also being asked to ensure proper storage and transportation of blood. And since their registration is mandatory, there are quality checks that are done on these blood banks from time to time to ensure that they are following the guidelines very strictly. Okay, and all these are the things that has been these are the steps that has been taken by the government. And now we can say that a lot of many changes are coming up when we talk about the spreading of HIV/AIDS through blood transfusion, because the government has made certain conditions very mandatory, especially the registration of the blood banks mandatory. So you cannot operate a blood bank until unless it is registered under the government. And since it is registered, there are proper checks that are being taken. And because of these efforts of the government and the also the you can say the awareness programs that have been run by the government from time to time, we can say that it has brought substantial decrease in the number of cases caused because of these blood transmission. Okay. Now, after this, we talk about the mode of transmission of HIV from mother to child. Okay. Now, we have studied two modes. One is through unsafe, unprotected sexual relationship. Second is through the transfusion of blood. Third, most important, is the transmission of HIV from mother to child. Now, we have already seen this, how the child may get infected during the process of birth, or even during the, you can say, during the feeding. Okay. Now, what happens? Women, because of their social and sexual subordination, they are disproportionately they're affected by this epidemic. In most of the societies, we will find that generally women do not have the say in most of these matters. Okay, like even in such things like use of condoms, generally women they do not have a say. Now, the inabilities of women to control the factors at risk, it places them at a very high risk of infection. Okay. And this is again compounded by the fact that many societies they define the social and cultural identity of women mostly through their role as child bearers. Okay. So whenever we discuss this concept of mother to child transmission, we have to look at this problem in a very broader perspective. Okay. That is the role of the husband, the societal pressure, the norms and the values of the society and the culture, and above, the rights of women over the sexual act as well as their own body. Okay. Excuse me. Now, there are millions of women of childbearing age throughout the world who are HIV positive today. Okay. And among these women who are pregnant, the highest rates of infection has been reported from several countries in the sub-Saharan Africa. For example, in urban centers in southern Africa, the HIV rates among pregnant women has been in several anonymously at antenatal clinics was found to be between 20 to 30%. This is the current rate. Okay. Rates above 40% to 59% and even 70% have been reported from countries like Botswana and even parts of Zimbabwe. Now, there is this agency which is run by the United Nations, which is known as a UN AIDS. They say that that there are very few places outside sub-Saharan Africa in which the prevalence of HIV infection among the pregnant women has reached 10%. But in certain countries, it is as high as 70%. So now you understand that this is a very, very, very serious problem that a large number of population are facing, and another population are at a very high risk. Okay. Now, in a period of 10 years, from 1985 to 1995, the incidence of increase in HIV transmission in women, it has increased to a great extent. Like in France, it increased from 12% to 20%. Even in countries, like which are quite developed, it is the spread is quite high when it comes to women. In Spain, it rose from 7% to 19%. In Brazil, at the same time, it rose from 1% to 25% in the 10 years. So this is how the percentage of AIDS has increased tremendously in that decade, in that decade. Now, what is the consequence of high level of infection? Can anybody tell me what is the consequence of high level of infection on the children? Anybody? How can it impact children?
Come again, madam.
Yes.
No, I'm saying, madam, come again. The question: how can it impact? Come again.
I'm saying what is the impact of high level of HIV infection among children?
Okay, let me just give it a try.
Okay.
It leads to growth impairment. When a child has got the virus HIV and AIDS,
Uh-huh.
his body is compromised due to different kinds of diseases. So um, the child does not grow properly just because of
Mm-hmm.
the virus. So that's the first effect.
Yes, good. Yes, Francis.
Yes, there is a high mortality rate
Uh-huh.
relating to children that are affected with HIV from their mothers,
Okay.
especially those who haven't been treated well and
Mm-hmm.
those who haven't been diagnosed of the problem.
Okay. Good. Right. Anybody else who would like to add to it?
Yeah, okay, a single health problem leads to so many health problems. So
Mm-hmm.
you see that this child at a certain point will be malnourished, especially this part of Africa. Malnourished children cannot cope well with the learning processes in class. So in the future, this person will not be able to process small things that children of the same age can process. There will
Okay.
be discrimination against these children. Their peers will separate them, say this one is disease, it can't be part of us. And
Okay.
the
Very good.
yes,
Yes.
sure.
Yes. True. Yes, Candido and Emmanuel, then Emmanuel. Candido first, you tell me.
Yeah, the consequences of high levels of HIV/AIDS in children otherwise can create some problems like orphanhood. The loss of parents due to HIV/AIDS can lead to significant increase in numbers of orphans. These two,
Okay.
I mean, no, I mean, these children may face challenges in accessing education,
Mm-hmm.
healthcare, and social support.
Okay. Yes, very good,
And
Candido. Now, Emmanuel and then Anas.
uh,
Right, Emmanuel.
and And another thing,
Uh-huh.
hello,
Yes, yes, Candido, we can hear you. Yes.
it can also create health consequences. Children with HIV/AIDS often experience more rapid disease progression than adults,
Okay.
leading to leading to severe illness and the weakened immune system.
Okay, good. Good, Candido. Emmanuel, you wanted to say something?
Okay, I just wanted to add more on what Francis said about malnutrition. What happens is that
Uh-huh.
when a child is being born with the virus, and it happens that the child is from a poor family. That means the family is gonna struggle to get good food, more nutrition, good food, and even expensive medical facilities. So this will definitely lead to
Mm-hmm.
the parents more poorer and more poorer just because of this child that's born with HIV.
Okay. Okay, Emmanuel, thank you. Anas, you want to say something?
Yes, ma'am.
Yes.
As I see my aid treating to reverse years of steady progress in child survival.
Okay.
Such measures as the promotion of breastfeeding, immunization, and oral rehydration. That's what I want to add now.
Okay. Yeah, thank you, all of you. I mean, actually, you are very correct when say that, and I'm really happy that I see a lot of changes, in kind of increased participation in the class, and also the way you are able to actually concentrate. If for 2 hours, it's a long class, but I'm really happy that most of you, irrespective of the environment, you're still able to concentrate. So that's really nice. Okay, so all of you are correct. There are a lot of consequences when we have a high rate of infection among the child. First of all, there are consequences on the individual. Okay, like you have a child who generally has developed a disease which inhibits the holistic development of the child, inhibit proper development in the child, creates lot of problems relating to frequent illnesses and also decrease their lifespan. So most of these children who are suffering from HIV/AIDS, they are generally very much discriminated in the society. They are not able to get proper nutrition. Most of them are denied education and other rights. So individually, it has very severe consequences. Even as a society, as a nation, there are so many, consequences. For example, uh, generally, when there is a high rate of infection among children, we say that the society is definitely going to suffer because they are going to have so many individuals who are actually sick, specifically children who are going to be sick. So what can you expect, when they grow up? Will they be actually able to become healthy citizens contributing to the workforce? Definitely not. So it is kind of a social loss, it is kind of an economic loss, and most importantly, it leads to lot many human rights violation on the part of the individual also. So there are several challenges that these countries who are having high HIV prevalence rates among children. Now we come to the important question is how exactly the transmission among children that is happening, how the children are getting infected. So the first factor is the when the child is growing up in the womb of the mother. What happened throughout the period of pregnancy? Mother is capable of infecting the fetus because the fetus is receiving nutrition from the mother through the placenta. Now, do you know what is a placenta? What is a placenta?
Hello.
Yes, Francis.
A placenta is part of the debris during childbirth from a woman.
Yes, but it
During
is not always a debris. What exactly is a placenta?
uh, we would say that it's an organ of reproduction.
Okay,
However, yes, it is expelled after birth. It is the
okay,
placenta which contains food, gaseous
okay,
exchange, contains blood and nutrients during fetal development up to delivery.
okay. So, yes, right. Placenta
Hello.
is basically, yes, Chipiriro.
Yeah, a placenta is like a special organ that forms in
Mm-hmm.
a pregnant woman is dairy.
Yes, good. So it's basically a special organ which is formed and it provides the nutrition to the child. So usually the mother has a high viral concentration in the blood, and sometimes the virus it can pass from the mother to the fetus through the placenta, which is providing the nutrition to the fetus. And usually it is seen throughout the period of pregnancy that a small number of fetus, they get infected through this route. So the placenta can be one important route for transmitting HIV. Another way in which the child may get infected is at the time of birth. What happens at the lining of the birth canal or the vagina? It contains high concentration of HIV. Now, at times, the baby may sustain some minor cuts in the mucous membrane and in the skin during the process of birth. Okay? Though in this way, the baby it can get infected. And maximum chances of infection of the fetus occurs during the time of delivery. And a significant percentage of children born to HIV mothers, they get infected at the time of delivery. So we see that these things are very common during the time of delivery. Another route through which the baby may get infected is through breast milk. Okay, and around 14% of children who are breastfed by the HIV infected mother, they will contract the infection. Okay, and hence practices which change breastfeeding, they reduce HIV transmission quite to a great extent. Now, the rate of mother to child transmission under different circumstances can be stated like this. First of all, where no drugs are administered and the baby is, yes, Emmanuel, you want to say something?
Yes, man.
Uh-huh.
You have said something about how the baby can get the virus, and
Uh-huh.
now just curious on this issue of breastfeeding.
Yes.
So breastfeeding, I thought it happens with, for example, here in Malaya. I don't know if it's international. I don't know if it's a standard by WHO. But what
Mm-hmm.
happens is that a mother is advised to stop breastfeeding his child less than
Mm-hmm.
in a so from the research or from something that I heard, it is that it prevents the child from biting the nipples of the woman.
Mm-hmm.
So is it that the milk can contain a virus, or the virus can be transmitted by when the child has bitten the nipples of the woman? Which is which, madam?
Pardon, Emmanuel, can you just repeat your question another time?
Okay, fine. I'm saying
Mm-hmm.
you are saying a baby can get the virus through breastfeeding milk.
Uh-huh.
So thinking that, does the milk contain the virus, or it is when the baby has bitten the teats or the nipples of the woman?
Uh,
I don't know if you
well, at
understand what I'm saying.
times, see, actually, it is not very clear as to how that infection happens. But generally, it is seen that many times this can be this can happen that the baby when it is breastfed generally it gets infected maybe through the milk, or maybe sometimes even it, as you said, that maybe because you know that they are biting the nipple and all that. Generally it can be through both the things, because the thing is you need to have directly it need to go into the circulation directly, right? So usually it happens that it may generally it is not yet clear how this thing happens, but it is seen that after the baby is born healthy, he or she may contract if it is breastfed. Okay, the mechanism is still not clear, but generally it is seen. Okay,
Okay,
and
madam.
but
I was,
again one thing is that this can be reduced to a great extent if we use certain drugs to okay to the baby, and this subsequently reduces the chances of the baby getting infected by HIV positive mother, because you know what happens in many of the societies where the mother are breastfeeding the baby, you cannot ask them to stop the breastfeeding. Okay, why? Because many a times they do not have the resources to actually feed the baby with the supplements. You know, these supplements are generally quite expensive, and not everybody can use these supplements. And if you use some other milk, you know, like cow's milk and buffalo milk, they are also supposed to increase a lot of other infection in the body of the child. Okay, for example, many of time these milk, it has been studied to actually cause a lot of infections, dysentery and diarrhea among the babies. And sometimes there has been quite many infant death reported because of, you know, internal bleeding of the child because of the consumption of such milk. In many studies it has been reported like that, that the child is not able to tolerate that milk. So that is why it generally not very much considered a good idea to stop the woman from breastfeeding. So nowadays, what happened that generally they give them some against antiretroviral therapy that is provided to the child as well as the mother. So that subsequently reduces the percentage of HIV infection. Okay.
okay, but then if they are, if the mother is on treatment and is
Uh,
on errors, that
mm-hmm.
means when you be taking the viral load will definitely decrease. So when the viral
See,
load will definitely decrease,
mm-hmm.
when the viral load will decrease. So
uh,
my question was, is the virus, a virus lives in the milk, or it is this thing that the health experts say that when the baby has got some teeth developing and then it bites the nipples,
mm-hmm.
that comes out of the nipples into the baby, and then the baby gets the virus,
No,
or is it, it
it
is not
can
yet
be,
known?
it can be. See, generally the virus will be there in the body fluids. Okay, so it can be through both the ways. Okay, and this is very much among people who are newly infected because they have a high viral load inside their body. Okay,
Okay, understood, understood.
yeah, yes. Okay, now we come to some of the issues which are related to mother to child transmission. Okay, now there are a lot of issues that are there. For example, whether an HIV positive woman should be encouraged to have a child, whether HIV positive mothers they should not breast feed their infants, whether every person should undergo HIV counseling and testing routinely, or should positive men and women marry among themselves or not? So, what is your say on that? Okay, just let me ask. Do you think that a person, a positive HIV positive woman, should be encouraged to have a child? What do you suggest? Anybody? Yes, Francis, what is your take on this?
You see now with the recent technology, we have seen advances in mother-to-child prevention strategies, like the
Okay.
BMTCT strategies. And I'd love
Uh-huh.
to challenge you to say, I work in the hospital setup. I've seen children being born free from mothers who are HIV infected, and the children growing up to their second year of life and discharge them from the program uninfected. So with this technology, I believe it's okay, considering that it is also a basic and fundamental human right of every citizen to reproduce. It would be
Mm-hmm.
unfair to advise an HAP client to say do not give children when there are strategies that can help to prevent the transmission from the child to the mother. I believe this is the greatest concern amongst the couples. Couples will understand that my partner is HIV and going to
Mm-hmm.
marry a partner with HIV. But now the greatest question comes on when we are married. Now, are we going to be able to produce children? Yeah. So
Okay.
if I were to cancel a client, I would cancel him or her to say you can get married because there are other strategies that we can use that can prevent both of you as a couple not to get the virus and the baby in case that you have been blessed to have children.
Okay. Thank you so much. So, what happens is that um it's it's a fundamental right, of every woman to go for a child. So you cannot stop the woman that you should not be having a child because you are in HIV positive. Okay. And so this is a decision which has to be taken by the individual, by the mother. Okay. And rather than anybody else. The important thing is, important thing is that you need to understand that this is a decision which has to be taken by the mother alone and not anybody else because she is the one who has to take care of the child and also give birth to the child. So it is the woman who would decide whether she wants to go for um, a baby or not, and what are the choices before her. So nowadays, with the advances of science and technology and medicine, it is seen that generally these things can be easily prevented. So if the woman is given retroviral, antiretroviral therapy during the pregnancy, and there are certain other things that are taken into consideration during the childbirth, then we see that generally the this mode of transmission from mother to child, this can be decreased to quite some extent. Okay. So this is the first question. The second is whether the HIV positive mothers, they should breastfeed their infants or not. What is your say on this? Anybody? Anybody? Should it be done or not? Okay. Yes. Francis, yes.
Breastfeeding, I believe, should be done on HIV mothers, especially those of us living in the part of Africa. You know that poverty levels are high, and the HIV is also common amongst the people of low income, which means it would be hard for them to afford artificial milk. uh, we may prevent the kid from HIV, but let alone die from malnutrition later in life. So uh, I believe that is good that mothers should breastfeed their children because with the priority, the risk is minimum as compared to those mothers who haven't yet taken any ARVs before. So it's good simply to encourage those mothers who have been tested positive to start ART earlier so that they have a chance to feed their children up to just the second year of life and prevent malnutrition. Thank you.
This is true. That is very right. Generally, you cannot, say that, the breast feeding should not be done because, especially in the developing countries where the supplement for mother's milk are very limited, or the where what happens is that usually either the supplements are available or they are very expensive for the mothers to actually give to their children. And at times, as I've already said, that sometimes the children may suffer from some other very severe infections when they are fed on some other milk, like, many times cow's milk or buffalo milk or a goat milk. At times nowadays, what happens is they also that they may cause some kind of a problem in the children if they are fed on these other supplements. So, of course, this is something that we cannot, it is not very advisable. Another question is that should every person undergo HIV counseling and testing routinely? Anybody who wants to say something? Anybody, do you think it is good, advisable to go for a routine test? See, of course, it is always good to go for. Yes, Ahmed, you want to say something?
Yes, madam.
Yes,
Yes,
Ahmed,
it's
tell me.
good details for HIV health. Even here in our community, you know anybody, know anybody that can allow to got married without the HIV test. Even in our community, you must possess the HIV test result before you
Hmm.
can get married to someone.
Okay, okay, okay. That's good. In fact, even in many states, many provinces in India, they have made it mandatory for the couples to actually go for an HIV test before they get married. So, in fact, it is very advisable for persons to get themselves tested routinely, especially those who are under high risk, such high risk where, for example, among the homosexuals or those individuals who are having multiple partners or those who have been through, um, blood transfusion or routinely go for a blood transfusion, such a population should in fact go for a routine test. And otherwise, also, it is advisable that every individual should go for this who are in fall under any of the other category. Okay. Now, another question that is there is whether HIV positive men and women they can marry among themselves or not. So, what is your take? Anybody who can give me some insight into this? What is your say on this?
Hello, ma'am.
Yes. Yes, Anas?
Yes, ma'am. They can marry if one have a feel of saying that, am I a
Okay.
positive or not?
Okay.
All of they are positive to HIV. They will not be thinking of I'm going to be infected with HIV. I'm not infected with HIV. So I think to get married between a positive male and female is very good,
Mm-hmm.
stable with each other.
Okay.
Thank you, ma'am.
Thank you, Anas. Thank you so much. Uh, of course, see, where as far as the human rights is concerned, as far as the rights of human beings is concerned, HIV positive men and women may marry among themselves, and there has been so many cases where people they have chose to get married or live together. Of course, the main risk pertains to the choice of having their own biological child. Okay. And morally and ethically, it may not be appropriate for an HIV positive couple to go for a biological child because there are high possibilities for the child to be born with HIV virus. But then such children may not get a healthy environment, of course, to grow and lead normal life as its own parents are not healthy. And even for such couples, they will require appropriate counseling from time to time because there are so many things that they would have to understand and that they would need to practice when they are living a life together. And so, of course, there's nothing wrong in the people marrying each other who are suffering from HIV/AIDS. But as far as having a child is concerned, that is something that they will have to think and they would require proper counseling before they take a decision. Okay. Now, what are some of the preventive strategies that can be employed to prevent a mother-to-child transmission of HIV? Now, the first and the foremost important thing in this is protecting the girls and women from getting HIV infection. Okay. So if the number of girls and women, they are not, they are protected from getting HIV infection, then normally the child will definitely not get. Okay. This strategy of minimizing the number of women of childbearing age who are carrying the virus is referred to as a primary prevention. Okay. Now it involves promoting safe and responsible sexual behavior among couples and providing them with knowledge about HIV/AIDS, how to prevent this infection. Also means that you provide treatment programs for sexually transmitted diseases, the presence of which increases the risk of HIV/AIDS many times. Okay, almost 6 to 10 times it increases the risk of getting an HIV transmission if the couple or any of the partner is suffering from a sexually transmitted disease. Okay. Now, steps they also have to be taken to deal with the cultural, legal, and economic factors that make the girls and women especially vulnerable to HIV infection. Okay. By limiting their autonomy and their power to protect themselves. So it is basically the responsible of the whole society altogether to provide protection to girls and women so that they are able to live a healthy life free of HIV/AIDS and also provide a healthy life to their future generations. Okay. The second would be to provide HIV counseling and testing. So this must be definitely done to enable the target population to know their HIV status in advance. Nowadays in India, for example, every woman who is found to be pregnant, they have to compulsorily go for HIV testing and some and testing for some other sexually transmitted diseases. Okay, so there's generally a blood test that is done on them, and this is has been made mandatory by the government. And I'm sure that this kind of a testing is also done by several countries that you people are living in. And this kind of provides, ensures that the child that is going to be born does not contain the HIV virus. Okay. And in case the women are found to be, uh, HIV positive, then they are provided proper counseling services. Okay. And this is also very much important for early detection. Then, and again, an integrated package of measures consisting of voluntary HIV counseling and testing that also enables the target population to know their HIV status. And every detection will also help victims to seek medical intervention because once they know that they are HIV positive, they will be able to go for medical intervention, go for antiretroviral therapy. Okay, so this again helps in preventing. Then one thing is what is known as antiretroviral prophylaxis. Now, the provision of antiretroviral drugs for HIV positive pregnant women and sometimes their babies including counseling on infant feeding and support for the feeding method chosen by the mother. This is known as the antiretroviral drug strategy. Okay, so we have already said that nowadays, although there is no proper cure for HIV, but there are certain drugs that can actually prolong the life of individuals, okay, by checking the infection and slowing down the progress of that infection inside the body of an individual, which includes not only this drug but also the changes that they need to make in as well as far as the lifestyle is concerned, as far as their nutrition status is concerned. So all these changes that is made, and this package which is given to individuals, that is known as the antiretroviral drug strategy. Okay, got it? Apart from this, there are some other prevention methods also, like uh, people need to be adequately, especially specifically in mothers, you know. There are practices in some village communities or in joint families, extended families, specifically like in countries like India, to feed infant. Yes, Emma, do you want to say something?
Yes, I write it at
Emma?
the chat, madam. Yes, I already wrote it at the chat box. Yes, there is a first question that you asked about the marriage between two victims of HIV/AIDS, so that I just wrote
Okay, okay,
something
okay.
about.
Okay, yes, yes, of course, of course. So, of course, we've also discussed that of course, two persons, individuals who are HIV positive, they have all the right to get married, to live together, and you know, share the love and compassion and the you know care for each other. But there are certain issues that are still there, especially when they decide to have a child. So they have to have sound counseling and other you know awareness programs before they decide to have a child of their own. Okay, now one important strategy that generally is practiced in order to prevent infant from getting infected is to see that the HIV positive mother it opts for a cesarean section instead of a normal delivery. It is generally seen that a normal delivery can cause HIV transmission to the infant during the passage of the child through the birth canal. Okay, which is very tight, and also there is a high concentration of HIV virus over there. So, and since the body of the baby is very delicate, therefore, an attempt must be made to go for a cesarean section, for a C-section, you know, going for an operation rather than going for a normal delivery. Okay, so this is all about the modes of transmission of blood. One is the sexual mode of transmission, second is through transmission through blood and use of infected needles, and the another one is HIV transmission from mother to child. So this is how we see that the transmission of HIV is different from other communicable diseases because there are only these four reasons or these four modes through which HIV can pass on from an infected person to a healthy person. Okay. Now, our next part of the discussion involved the HIV testing and the issues involved in that. Now, a lot of you have said that HIV testing is something whether that has been promoted by the government, and of course, that is the only way in which the HIV status of an individual can be determined. Okay, now symptoms of the disease alone is not enough to conclude that a person is having AIDS. Okay, and people who have exposed themselves to high risk behavior or such situations, they need to go for an HIV test on a regular basis, and Such persons may have to seek the opinion of a counselor or a social worker or a psychologist or a physician. Okay. Now, many times we nowadays we see that there is generally a counselor or a psychologist who is there in most of the hospitals and some other civil dispensaries, and they give their services to the persons who come for HIV testing. Now, uh, what happened that generally there is a whole range of tests which are generally done on individuals, and and uh, generally two tests are supposed to be there. One is what is known as the ELISA test, okay, and the other one is known as the Western blot test. So these are the two tests which are generally administered on individuals. Okay. And now what is the basis of these tests? Now what happens is that it is very difficult to grow the virus under the lab conditions. Okay. And generally in the laboratory, the virus is grown in a suitable growth media. This is known as a virus culture. And it takes around 6 weeks for the culture to become positive. And it is very costly. Hence, the HIV virus is generally not concerned. It's not cultured. I'm sorry. A simple and effective test is necessary to detect the presence of HIV in the body, and that is why we use the presence of antibodies against the HIV virus to detect its presence. So, what we do is generally when we are using the lab test, we culture the bacteria or the virus and we see their growth in that blood sample. But in case of an HIV virus, it is difficult to grow it, okay, in a virus culture, in a viral culture, and it takes a very long time. And it is quite costly. So what we do that instead of going for a culture, we test the presence of antibodies in the blood of the patients. Okay. Now, when we were looking at the progression of the virus, we saw that there is one period which is known as the window period. Okay. Now, what happens is once the virus enters the body, it starts to multiply. And during this process, the test does not detect the virus. So generally, this is called as a window period because generally the virus are not detectable. Although the patient is highly infectious, but you cannot detect the presence of virus in the blood. After 6 to 8 weeks, the body it start producing antibodies, and this is the time when the tests become positive. So the ELISA and the Western blot test, they are actually based on this concept of checking the blood during the after the window period for the antibodies, for the presence of antibodies in the blood. And similar situation may occur in terminally ill patient when his body it cannot produce antibodies, just like the window period. So the test will be negative while the patient will have the infection. Okay. And in this case, also the test turns out to be negative because it takes 6 to 8 weeks for the antibodies to form. Okay. And in the terminal stages, the immune system may be destroyed so that there are no antibodies produced by the body. So these two times, okay, one is the window period and one is the terminal stage of the disease. In these two periods, these tests, they do not work. Now let us see the types of tests. As we've already seen that there are two different types of tests for these. One is known as the ELISA, which stands for enzyme-linked immunosorbent assay. Okay, now this is a short form for this whole uh, uh, term, enzyme-linked immunosorbent assay test and the Western blot test. Okay, now both these tests, they are very cost effective, they are very sure shot, and they are quite sensitive. Generally, usually it happens that they generally are quite sensitive to the presence of virus or antibodies in the test, and these are by far the most efficient tests that have been generally there are that are generally done. And nowadays, generally the government in most countries they provide the free testing for individuals who may have HIV positive or who may be HIV positive. Okay. Now, generally, for the patients who come for these tests, there have been provisions of going for a pre-test counseling and a post-test counseling. Now, these are the two types of counseling which are generally done on the patients who come for these HIV/AIDS tests. So, if a person is suspicious of carrying HIV virus in their blood, then what they do is that they are suggested HIV test to by the physician. Now, when these individuals come to the medical colleges or they come to the clinics or some other medical facilities, they are also generally provided a counseling which is free of cost by the counselors or the psychologist there. Now, there are two types of counseling that are done on the patients. One is what is known as the pre-test counseling, and the second, which is known as the post-cost counseling. Now, what does the pre-test counseling consist of? Now, this is one of the most important counseling among the types of among the other all types of counseling. It generally helps to establish a rapport between the patient and the counselor. Okay, and it helps the counselor to gauge the patient, see what the patient is going through, what are the behaviors or social behavior or the other habits which is shown by the patient. And it may be the only contact that a person will make with the healthy system, before he or she is diagnosed with HIV/AIDS. So that is why this counseling is taken very seriously, and the counselor tries to see the kind of habit that a person may be having. The counselor also suggests them the kind of changes that they need to bring into their lifestyle, their heat eating habits, their lifestyle patterns, their sexual behaviors, all these things in order to lead a healthy life free of HIV/AIDS. Okay. They also tell them that, okay, what they can expect out of the test, and after they test, what are the other measures that they need to take into consideration. Then uh, after this, we also in this test we also give clarifications about HIV/AIDS. Okay, so we tell the patient about what are the do's and the don'ts that they need to understand, what exactly HIV/AIDS is all about, how it is transmitted, what are the impact of HIV/AIDS on the person and on the body. So all these things, health education, everything, clarification about the test. Okay, all these things, these are done about the in the um, pre-test counseling. Another one is known as the post-test counseling. Now, the post-test counseling could be done if the person is negative, or as well as done when the person is positive. So, in both the cases, even if the patient is coming negative, coming clear of the post-test of the HIV/AIDS, even then the patient needs to be reminded about the window period. Okay, so there is a high chances that the patient may be in that window period where the virus does not show, the antibodies does not show in the blood. So in this case, he is generally asked to repeat the test after 6 months. Okay, and also he or she is told how can they reduce the risk of acquiring the infection in the near future. And in case if the test comes positive, then the post-test counseling on such positive individuals consist of a series of steps, which includes, first of all, breaking the news to that person. Okay, so you need to, it should be broken very gently to the patient after adequate counseling. They need to know that, okay, you need to be sure and definite that the result is actually positive, and they need to be handled in a way that, okay, you need to be very much understanding in this particular case if the person comes positive, because he or she may have different reactions to it. Then another part of this counseling is preparing a medical plan. Okay, the counselor assist the medical help Okay, many a times the hospitals will not may not be willing to to treat HIV patients, so the counselor will have to identify the hospitals or the doctors who are willing to treat HIV patients, and then they refer them to those patients, to those doctors, and to those hospitals. Another is providing social support. So, not only the patient per se, but also we need to counsel the family or the relatives or the caregivers who are looking at the patients. And we need to, every problem, it needs to be assessed, okay, and start with the family per se. So, because sometimes what happens, the individual or the patient may not be very much willing to break this news to the family. But this is something that the family must know, especially if the individual is married or having a partner, okay, intimate partner. So, in this sense, it is very important that this kind of a disclosure should be made. So, we need to make the patient aware that this is for the good or for the benefit of the whole family. Okay. Then we also have to plan for the future. Okay, how he or she, how the patient needs to be cared for at the time of illness or the terminal illness. Okay, where can he or she go? Okay, help him or her to make those decisions related to the future. Also, another very important aspect is reducing the high risk behavior. So, we need to counsel the patient or tell them the ways in which he or she can reduce high risk behavior so that this, again, this infection is not transmuted to other persons or to other individuals. Also, uh, this is basically if the patient is drug addict, we need to find proper facilities that will help to give them to give up drug addiction. Okay, and all these are the various helps that a counselor generally provides. So it's not just the medical counseling, but also it's a psychosocial counseling. We need to provide them with the emotional support or any other support that we can help the patient with. Like, for example, sometimes the patient may have some financial issues, some financial constraints, then the counselor may help, refer the person to such agencies where the person can get free of cost help, or maybe some government programs which are providing some kind of benefit to these HIV positive individuals. All these things we have to understand. Okay, so all these things are generally taken care of in the pre-test and the post-test counseling. Now, one question comes up is, who are the groups who need to be tested for HIV? So we have already seen that every individual can go for a HIV positive HIV test if there is a feeling that maybe we or anybody in our family or anybody we know has indulged into some kind of a high risk behavior, like going for multiple partners, intimate partners, or a person who has been, going for undergoing treatment, yeah, frequent blood transfusion. Such high risk behaviors, individuals with high risk behaviors, they need to specifically go for frequent testing of AIDS. And even if the test comes negative, then we need to understand that that individual may be going through a window period. So we need to uh, ask them to go for a repeat test, okay, to make sure that the individual is not carrying infection, HIV infection. Okay. One important aspect of these tests is that all testing should be done on a voluntary basis and with informed consent. What do you mean by informed consent? Can anybody tell me what is meant by informed consent? What do you understand by informed consent? Informed consent simply means that the patient will have to undergo a pre-test counseling. Okay. No test should be done on an individual without a pre-test counseling. So they should be having no knowledge of all the pros and cons. What if the test comes out to be positive? What if the test comes out to be negative? Even then, what are the various uh, things that we need to take into consideration? All these things will be informed to the persons, to the patient, okay, in case of a pre-test counseling. So, generally, in many situations, generally this pre-test counseling is not done, which leads to a lot of difficulties for the patients as well as the healthcare workers who have to deal with the patient. So, generally these counselings should be compulsorily provided to the patients before they are asked to go for a test, okay, either a ELISA test or a Western blot test. Now, next is going for the types of testing situations and strategies. Now, there are various types of testings that are done, which include first is a voluntary testing. Okay, we have already described that the person gives an informed consent for a voluntary testing, like the patient voluntary goes for a test. Second is surveillance testing, and the third is a mandatory testing. Now, what is a surveillance testing? uh, Generally what happen that sometimes it is essential to know the prevalence of a disease in a community, which helps planning for healthcare for the community as a whole, and in finding effective control measures for the disease. So voluntary testing may not give a very true picture because it's generally anonymous testing which is done, and so generally the identity of the patient is not known. And in this method, blood that is collected in the laboratories is used. So after that test has been requested, that is performed, and a sample of the discarded blood is used for testing for HIV. So this sample will not have any patient identification or written in that. In the clinics which are testing for various sexually transmitted diseases, blood is usually collected to test for syphilis or other STDs. So after the test is done, the remaining sample is sent to the surveillance centers without any patient identification. This survey gives an idea about the prevalence of HIV in high risk groups. Okay, and such studies they are also done on the mothers who expecting mothers to find the extent of risk involved in the community. And most of the reported cases in countries they are based on such surveillance. So this is what is known as a surveillance testing, okay, where it is basically to find the level of prevalence of this disease in a particular community. And the third type is what is known as the mandatory testing, where the HIV testing that is done compulsorily without any consent. This is known as a mandatory testing. Now we know that this testing generally is not recommended, but generally it is still done in several cases, specifically where the a person who's donating blood, okay, he or she has to go for mandatory HIV testing. Why? Because that blood, if it is infected, it may cause infection in to some other healthy person. Okay, and even in many countries, they have made it mandatory to go for a test for HIV test for a mother's to be. So that is why, because that can subsequently reduce the chances of HIV in the child. So, although this is not a very, something which is which should be done as a routine, but mandatory testing is still done, and there are a lot of countries which have started going for these mandatory testings. Okay, in various situations, like I have said, in India, for example, there are certain states that have come up with mandatory testings for the couples to go for before they actually get married. Okay, so that is also seen in several situations. And now, since HIV is such a serious disease, much care should be taken if you to make the diagnosis. Okay. And considering all these facts, the World Health Organization, that's a organization which is working as part of the United Nations, it has formulated a testing strategy for testing HIV in individuals. Now, in India, for example, the National AIDS Control Organization that has adopted the same guidelines. Now, I told you that all the countries in the world, they have taken some guidelines, these guidelines from United Nations, especially the UN AIDS, which is working specifically in the area of AIDS, HIV, AIDS, and infection. And in India, the NACO, which is the topmost organization to come up with strategies for preventing HIV spread of HIV AIDS in India, they have adopted these guidelines. So there are certain strategies. First is that only a single ELISA test is done. Okay, this is used only for testing blood or blood products. A single positive ELISA is enough to discard the blood. The reason why this is done is order to provide only safe and healthy blood to the patient who receives it. So even if there is any slight doubt, the blood is rejected. Okay, so in no way a blood which has not passed the ELISA test, even one, that is rejected totally. Okay. Then another strategy is in this strategy, two ELISA tests are done if a patient manifests clinical symptoms of AIDS. Okay, the first strategy was going for a single ELISA test. The second strategy is going for two ELISA tests if the patient he or she manifests some clinical symptoms of AIDS. So in this case, the sample of blood is tested by one particular method of ELISA, and if the sample is found positive, then a second ELISA is repeated using a different method, okay? And if the sample is positive even with the second test, the patient is declared as positive. Okay, got it? Now there is another third strategy. In this, three ELISA tests are done, or two ELISA and one Western blot test is done. It is done in patients who do not have any symptoms of AIDS illness. Now, if the blood sample is positive to two ELISA tests, a Western blot test is administered. And if all of them are positive, then the patient is declared as positive. Okay, so these are the three strategies which have been suggested by the WHO for the governments to take care of when they are going for testing of individuals. Okay, now one important aspect in HIV testing and counseling is the principle of confidentiality. Now, what do you mean by that? What is meant by confidentiality? Can anybody tell me what is confidentiality?
It's like keeping a secret to to the
Okay.
to the issues of the client.
Yes. See, confidentiality means that generally, if a person comes out to be negative, positive, then in that case, the identity of the patient will not be revealed under any conditions. Okay. That means that that person will not be, that the report of the person will not be made public, as in that. This is basically done to prevent the fundamental right of the individual. Otherwise, we know that this entire uh, thing of HIV/AIDS, it consists of a very strong social sanctions on the individuals, right? A lot of discriminations are made on uh, to such patients. So that is why the medical practitioners as well as the counselors who are looking at such patients, they are advised to go for confidentiality, to follow the principle of confidentiality, so that the uh, identity of the patient can be kept hidden. Okay, got it? Any questions till now? Any questions?
No, ma'am,
No,
just
ma.
carry on. We are okay.
Okay, okay, okay. Okay. Now, next we come to some of the moral and the ethical issues that are there related to testing. The first is the right to autonomy of HIV/AIDS patients. Okay, autonomy means actually self-governance, but here we don't. It does not mean self-governance. It is basically the freedom, basically, of individuals. You know, the freedom to choose. So, any patient who enjoys the gift of intelligence and freedom is competent to decide for himself or herself and has a right to make decisions for his or her life. Okay. So, if the patient is competent to enjoy the basic rights of autonomy, that means that there is a right to knowledge, okay, with regard to understanding what is happening to them, and also the right to know and accept what is being done to them with regard to diagnostic and therapeutic procedures. So you need to tell them in advance the kind of diagnostic procedures and other therapeutic procedures that they would have to go through. They have the right to get informed consent, to give informed consent, and of course, the right to enjoy confidentiality. Okay, so these are some of the major autonomous, issues related to the patient. The second is the ethical, we have to review the ethical advantages of testing. Okay, what are the ethical advantages of testing? Why testing is important? First of all, testing can tell the person whether he or she is carrying the virus or not. And this can be useful to the individual in two ways. First of all, it informs the individual of whether or not to expect the onset of a serious illness, okay, so that the person can take adequate precautions and treatment of the illness. And the second, it tells the person whether or not he or she is likely to transmit a lethal virus to another person by intimate contact. Okay, so these are two ethical advantages of testing, and the reason why large scale testing or frequent testing of specifically individuals who are prone to HIV/AIDS is very much suggested by international agencies, and this is something which has been adopted by the national governments at for the masses. Okay. Now, there is also the general principle for testing, whether it should be made voluntary or mandatory. Now, there are again, we say that there is a widespread debate. There is a worldwide, there is a debate on basically whether such a test should be voluntary or they should be made mandatory. But then otherwise, there is always this case of right of an individual versus the right and the security of the community on a whole. Okay. So we have to understand that an individual may be enjoying certain rights, but these rights are not absolute. Okay. It also comes with certain duties that an individual has to follow. Duties towards societies, duty towards his or her family, okay, towards his or her intimate partners. So these are certain things which are definitely being debated. But one thing needs to be understood is that irrespective of the individual right, we have to understand that the security and safety of the community as a whole is of utmost importance. And that is why the mandatory testing has been, um, you know, uh, provided by government in many instances. Okay, so the government goes for mandatory testings because of the same, following the same principle. Then there is another question of compulsory testing, whether testing should be made compulsory for a certain groups of individuals or for the entire population. Like, this is something can which needs to be taken situation by situation. Okay, for example, healthcare providers, they are at a risk for HIV infection. Okay, though they may not be having any kind of high risk behavior, but the fact that they are being, um, you know, uh, exposed to everyday situations where they are dealing with blood products, where they are dealing with individuals suffering from HIV, AIDS, all these scenarios. So again, this question of compulsory testing, this is something which comes up again and again. So there are 10 conditions where mandatory testing has been given by WHO. The first condition is whether test should be an important, the condition being tested should be an important health problem. Okay, the person should be suffering from some health problem. That is why there has to be a mandatory testing involved. Second, there should be accepted treatment for patients who test positive. Okay. The third is that facilities for diagnosis and treatment should be available. Fourth is there should be a recognizable latent or early symptomatic stage among individuals, okay, uh, who are showing certain kind of early symptoms for HIV AIDS. There should be a suitable test for examination. Then the test should be acceptable to the population. Again, the natural history of the condition, including development from latent to a declared disease, should be adequately understood. There should be an agreed policy on whom to treat as patients. Okay. And the cost of case finding should be economically balanced. Okay. And the last is case finding should be an ongoing process and not a once for all project. So these are the 10 conditions that needs to be fulfilled when we want to make the HIV test mandatory. So these have been given by by the World Health Organization, and this is actually been accepted by the governments worldwide. Now, one question that comes up is what are the implications of universal testing? Okay. Now, what are the implications of universal testing? First is that even if universal testing could be carried out, it cannot detect HIV every time because we have seen the window period as well as the if the person is terminally ill. Then there is a danger that the uninfected population would feel a sense of security and not pursue precautions against infections. That could be a likely situation. Sometimes a universal or widespread testing program does not represent a practicable approach because of the costs. Okay, for the government it could be very high. That is why it may not be possible to go for a universal testing. Then HIV negative persons may not in fact risk at risk from the HIV positive persons living in their midst. So a wide consensus emerged that it would be mistake to enact laws requiring the entire population to submit to testing. So these are some of the important concerns that are there before we go for universal testing. So as of now, most of the times, generally it is considered that at least for some of the groups of individuals which are at very high risk, they must be definitely made to go these testings, but these testings must be administered in a proper way with a pre-test counseling and a post-test counseling on the individuals or the patients, and they must be administered these testings after a consensus, and the principle of confidentiality should be maintained at all cost. Okay, so this brings us to an end of today's uh, session. Any questions that if you would like to ask? Any questions at all?
No questions, ma. So far, so good.
Okay, Manuel, thank you for your feedback. So
Thank you
tomorrow we
very much
will
for the
meet.
presentation, ma'am.
Oh, yes,
Thank you, Ma, for your presentation, Ma.
yes. And yes, thank you all of you for your feedback and for your inputs and for, of course, your participation in the class. I am again really, happy that you are taking so much of interest in this and actually having so much of knowledge related to this aspect of your studies. Now, tomorrow we'll meet again and we will discuss the third block. So till we have done 2 out of 4 blocks. Tomorrow we will start with the third block. And the last session, I will keep for any kind of problems or any kind of difficulties or clarifications that you want to go for. So one thing is, please start reading the material that is being given to you by the university. And in case if you have any kind of questions or any clarifications that you want, we can discuss all of them in the last session when we will meet. Okay. So tomorrow we will start with the third block. And thank you all once again for joining in today's session. I will see you again tomorrow.
Goodbye. Thank you so much, madam.
Thank you so much. Thank you.
Goodbye, ma'am.
Okay. Bye. Thank you so much.
Matthew was left to me. Stop recording button. Window for Shabby to enter. Stop recording button to activate the session. Stop recording is equal to recording. Save the new organize as Google Drive. Stop recording button to activate. Press enter. Shabby to date has left the meeting. Cancel button. Stop recording button. Space.